there are three trays here in the set. You've got 2 trays of instruments, 1 tray of implants. The trays are marked on the ends, but not on the top, so it's important to see that from the side. So there's instrument tray number 1, instrument tray number 2, and then there is an implant case. So you want to make sure the ends are visible. So when you lift off the lid, lids are all the same. They can be interchanged if you need to, so just for the case, you want to just take off all 3 lids, put them under the table, and it doesn't matter which lid goes back on which case, they're all the same. So you can see inside the tray here, this is number 1, so this has all of your screw prep, your pedicle prep, and your screw driving instruments are in instrument tray number 1. So everything's pretty standard here. You've got taps, you've got straight and eggshell or egg handle ratchets, and you've got all your bone probes. This is your screwdriver, and this is perhaps the most important thing I wanted to show you. The way the ratchets work, the ratchet has a little knurling on the collar here, and it's left to go left, center for lock, and right to go right. And then this little push pad here is what releases the driver from the ratchet. It's sort of a stab and grab action, so all you have to do is take it and stab it on, and it's locked. Then to release it, pull back and it releases, okay? So it's kind of different from other ratchets where they all have a collar that you pull back to load this. This one, you don't have to do that. You can just stab it on and then pull back to release. You can also pull back to release if you want. You just want to make sure you give it a tug and make sure it's locked in. Okay, so that's how you load the screwdriver, and the screwdriver has got a little sleeve on it that locks to this little collar here. So when you load the screw, you'll just sort of stab this on, and then you'll thread this into the screw. This threads into the tulip right here. And then when you're done, you pull back on this collar and pull this handle up, and it locks in place. And that keeps it from rotating when you're driving the screw. I'll show you that in a second, but there's the screwdriver. That's the most important instrument in the box. Everything else in here is fairly standard. So you've got, these are your starters for your set screws. The set screws are up in the implant caddy. So you've got 2 starters, you've got your double-handed bone probe, which probably no one will use because it's too long. So don't worry about that one. You've got regular bone probes in the top tray. So don't worry about using the double one in the bottom. So when you're setting up your room, you'll have your drivers out, you'll have your blocker starters out. This is your final tightener that goes into the torque wrench, and you can tell the difference between this one and the starter is the starter has the fixed handle on it. And this one has the quick release to lock into the torque wrench. These here are just sleeves that can go down on the screw, and they're cannulated, so you can go down on the screw so you can hold back the muscle wall if you need to, and then drive your set screw down through these. So they're just sort of a guiding sleeve, if you will. And you've got a T-handled handle on the bottom. So that's instrument case number 1.